Good evening, everyone. My name is Mitch Cohen, and I chair the Northborough Select Board. Today is Monday, March 18th, 2024, and I will call the Northborough Select Board to order. I have an opening remark. This open meeting of the Northborough Select Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2023 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Select Board, in addition to the Northborough Board of Health, are allowed to and encouraged to participate remotely. The Act allows the Northborough Select Board to meet entirely remotely so long as reasonable public access is afforded so the public can follow along with the deliberations of the meeting. And I'm not going to repeat Northborough Board of Health all the time, but so it counts too. Public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream or the recording of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation. Unless such participation is required by law, this meeting will feature public comment. I'm going to go around the room and ask the members of the select board to identify themselves and or rather confirm that they can hear and be heard just in the order on my screen. Julianne Hirsch.
Here.
Laura Zeiton.
Here.
Lisa Maselli.
Here.
Kristen Wickstead.
Here.
All right. We also have with us Town Administrator Tim McInerney.
Here.
Diane Wackel, Assistant Town Administrator.
Here.
And for some subsequent information, we have a couple people we will introduce shortly. So the primary purpose of tonight's meeting is joint with the Board of Health for a public hearing on a proposed administrative organizational change. We do have something else on our agenda that came up last minute that we're going to take care of quickly and then get back to the main purpose of the meeting. So I will invite Andy Dowd to tell us about the appointments of Terry Green and Kimberly Shepard as temporary registrars for the purpose of participating in a district-wide election recount on Thursday, March 21, 2024 at 9 a.m.
Good evening, Mr. Chair, members of the board. After the March 5th presidential primary election, a recount petition was filed by one of the candidates, a candidate for Republican State Committee woman. And she requested a recount based on, it was a 33 vote margin of loss in her case, although she won in Northborough by almost 500 votes. But the recount is allowed due to the percentage difference between the two candidates. So she filed a successful petition, and the recount will happen in each town within the district, which is our Senate district. So Worcester, Northborough, West Boylston, Boylston, Berlin, and Bolton. And our recount has been scheduled for this Thursday, as you said, March 21st. Due to my absence, I'm on vacation out of state, and also another registrar who is unavailable, we will need to appoint two folks as temporary registrars to serve in the recount. And just so you know, the registrars primarily serve as the judges at a recount. If a vote that is being hand counted should be questioned, it is brought to the registrars for review, and they make a final determination of, in their opinion, how the vote should be counted. So this will just be a temporary appointment simply for that event on Thursday only.
Any questions from the board? Not seeing any hands. I think you've done an excellent job explaining that to us. I don't think I have any questions either. You sent me some information earlier with a little bit of the details as far as the numbers. It said 33 votes, which was a little under a half a percentage point difference. So that's interesting. I am a big fan of recounts when they are justified, because oftentimes, really all the time that I've participated in them, they really validate the programming and the use of the counting machines that towns in Massachusetts use. So I have no reason to think it'll be anything otherwise. If this flips more than a vote or two here or there, I'll be surprised. It's a very interesting process if anyone wants to follow it. I know they are public, correct? Anyone can come in and observe from the proper distance.
Yes, it's open to the public if anyone wants to observe the process. We're going to be set up in the gym at Town Hall to give us enough space. They'll have teams of folks that will be hand counting the ballots. We'll have counsel there, police officer there. The candidates are allowed to have observers throughout the process. So I expect it'll take probably 3 to 4 hours. Is 1,820 ballots, I believe, that need to be hand counted. So depending on how quick the teams work, it should go fairly.
Excellent. Okay, last opportunity. Any questions, Laura?
I just have a quick question. Will we send out a note letting people know if the recount changes the outcome?
Yes, so actually the results of the election will have to be officially amended after the recount. There's a process through the Secretary of the Commonwealth's office for us to do that. So once that happens, we'll amend our results if they should change. It's possible they could be exactly the same, but it's typical, as Mitch said, that you may see a slight vote change, and that's because at a recount, if the intent of the voter is clear to the human eye, it's typically when someone may circle a candidate's name instead of filling in the oval on the ballot. The machine would be unaware of that vote, but in the laws allow that vote to be counted when it's hand counted at a recount. So that's typically what you see for a slight change in the numbers.
Thank you.
Okay, I don't see any other questions. So with that, I will entertain a motion.
Mr. Chair, I move the board vote to appoint Terry Crane and Kimberly Shepard as temporary registrars effective immediately for the purpose of participating in a district-wide election recount on Thursday, March 21st, 2024 at 9:00 a.m.
Second.
Okay, motion made by Laura, seconded by Julianne. Any other discussion? All those in favor, Laura,
Aye.
Julianne,
Aye.
Kristen,
Aye.
Lisa.
Aye.
Excellent. I also vote aye. Vote is unanimous in favor. Thank you very much for joining us, Andy, and congratulations to your new temporary registrars. And I wish you what I expect will be a very smooth recount on Thursday.
Thank you. And if I could just add, I want to thank my assistant Karen Wilbur, who is managing much of this while I'm away, and as well as we have several folks that are election workers that have stepped up to help, and clerks and their assistants from neighboring communities who are coming to help us on Thursday. So I greatly appreciate all of that assistance. So, and thank you for making the appointments tonight.
Pleasure. Thanks for joining us. You, of course, are welcome to hang around and watch our public hearing, or you may get back to whatever you would like. That concludes that item. So with that, I will, let's see, before we open the public hearing, Diane.
Yeah, I was gonna say, excuse me, Chair. Swati from the Board of Health is calling in. If you see in the attendee list, the phone number, that should be her.
She also might be the other me. Swati, can you unmute yourself?
The
Oh.
alternate Isabella.
I
Oh.
forwarded her the link, so maybe not.
Oh, okay. All right. I will set the phone number to allow to talk.
Ooh, it's another one.
And let's see. Hopefully the caller remembers it's *6 or *9 to unmute on phone. I don't. Someone here probably remembers.
Her.
We lose them.
I don't see that phone number anymore.
Correct. I don't either. Just looking it up so we can um, well, all right. Well, if the person calls in, we'll figure that out. So I see Dilip, is this how you pronounce your name? I apologize if I've got it wrong.
Yes,
Okay. Dilip, welcome from the Northborough Board of Health. Do we have any other Board of Health members on the call right now?
Lisa.
Yes, hi. I said hello earlier.
Oh,
So,
hi.
on the call, but I'm here.
Yes. Yes, thank you for joining us.
Virtually.
All right, so it appears we do not have a quorum yet of the Board of Health. Oh, we have another, okay. Let's see. I think the other you.
Swati, is that you?
Swati, is that you? You raised your hand. You're unmuted now. You should be able to speak. All right, so without that, we can't actually officially call the Board of Health to order because part of that process remotely is for folks to identify. If we have a confirmed third person from the board join us, then we'll take care of that. But for now, I will call to order the public hearing to consider the proposed amendment to the town's municipal code for the creation of the Health and Human Services Department and the reorganization of the Health and Inspection Services into the Human Services Division pursuant to Article 5 of the Town of Northborough Charter. So the public hearing is now open. What will happen here is Connor from CMRPC, I believe you're going to give us a presentation. Then members of the boards will have the opportunity to ask questions, and then we will open it up for public input from members of the public who are connecting by Zoom using whatever means necessary. You're connecting by Zoom. I'll be happy to recognize folks at that point. Then we'll return to the boards hosting this meeting again for any follow-up questions and comments. And then I will entertain, at the end of that process, we'll close the hearing and then entertain a motion on the proposal if the board desires to move that forward. So I want to start by thanking the staff members and many board members who many members of the public that participated in the survey that CMRPC put together. And this is a long time in the making that we've been talking about this kind of a change for a while, but at this point I will hand things over to Connor. If you could unmute, identify yourself, and you should be able to share your screen at your convenience.
Mr. Chairman, if I may.
Yeah, Tim, sure.
I was gonna run through a little bit of background for Connor, if I
Okay.
could.
Sure.
So I thank you and good evening, everyone. My screen just went crazy. Back in December, you may know that Kristen Black left us and you had an interim TA. And upon my arrival, they had requested that we move forward with a study to study a health and human services model, which merged family youth services and the Department of Health. So they thought there was a good motivating factor for that. They did a study with the Collins Center back in April 2023. Even though there was a lot of data that wasn't available for them to make a good decision, the Collins Center did recommend in that study to do a strategic study with another group, all with them. And that's exactly what Kristen did. She advanced this to CMRPC and ultimately to Connor to do this study to see if we could advance this change and enhance services for health and for family youth services. So I just wanted to make it clear that it didn't happen in a vacuum. We just didn't come up with it The board, of course, has been talking about it for a long time. But we should, thank Kristen and then Isabella for the work they've done to get us through this on an interim level. But in terms of Connor's expertise and his level of professionalism, I just want to tell you a little bit about him. I've known him since I was in Grafton way back when. And, he will cover the methodology, the process, the timeline, and ultimately the recommendation of the study with the boards tonight. He's the Director of Regional Services for Central Mass Regional Planning. CMRPC is made up of over 40 communities in southern Worcester County, obviously including Northborough. But CMRPC, for those who don't know, they work with municipalities on transportation, community planning, economic development, community development, resiliency, and other projects and topics. Connor, I think, was the conduit for local boards of health and State Department of Public Health during the pandemic. So there's a lot of work that he did regarding public health. And now he actually helps in Central Mass create the governance for the Greater Boroughs Health Alliance. I call it the Health Alliance. I know it's not the proper term, but he played a critical role with that. So he knows public health. He knows the needs. The study that he worked on here, it'll be displayed pretty quickly the level of thought and professionalism he put into this as well. So Connor's going to walk you through the study. I'll just ask Mr. Chair if it pleases you and pleases the boards, if we could wait until the end for questions. We could let Connor get through his presentation, and then we can take questions from the public and obviously from the boards. But that's my introduction of Connor.
That sounds good.
All
Great.
right.
Thank you very much, Tim. Before we begin, Isabella, I see that phone number again.
Yeah, can you try
attendees.
one more time to make her a panelist, please?
Absolutely.
And then Swati, you just do *6.
I looked that up too.
Can you hear us? Can you talk?
Okay, can you hear me?
Yes, perfect. Thank you so much.
This is Swati.
Great.
Okay, now that we have a
Yes.
quorum of the Board of Health, we have to delay you, Connor, one more moment for someone to call the Board of Health meeting to order. I don't see the chair, so I will let the Board of Health decide who is chair and absentee. I didn't see a vice chair listed on the roster.
So I am the vice chair.
Oh, excellent.
So I will call the Town of Northborough's Board of Health meeting to order on March 18th at 7:20 p.m.
And if you could ask each of
For the
the
roll.
board members
Okay.
to just confirm that they can hear and be heard.
Right. Lisa Bennett Johnson
Present?
and Swati Sani,
Yes, present.
and I, Dilip Jain, am present.
Fantastic. All right. Thanks for going through that. Connor, now it's your turn for real.
Beautiful. Thank you so much. And thanks for having me tonight. Thanks for shouting out all the people who did the survey. There were a lot, and all of the staff that took time to participate in meetings and interviews with me. Extremely insightful group and really generous with your time. Special thanks to Isabella in her interim role as director, and Tim, who, as I mentioned, I think in some ways inherited the project, but really embraced the challenge, met with me often to make sure we were on the right track, and they clearly care deeply about delivering the best possible services for residents, and that energy made this a really exciting project. So thank you for that. I'll walk you through some of our methodology. Our assessment involved a multifaceted approach to gather a thorough understanding of the needs and opportunities within the community. Included a town-wide survey posted to various Facebook pages, the town website, with social clubs, public access, the superintendent's newsletter. There were also flyers. I think Isabella was running around putting them at town hall, senior center, and the library, all resulting in impressive 184 responses. We held stakeholder interviews across most department heads and with several local organizations like Helping Hands, the Special Benevolent Fund, Metro West Health Foundation. And then we also held 8 meetings with model communities and statewide associations to learn from their experience. There are towns that have health and human services models, so that really helped define what the possibilities are. And there was a lot of data to pull from here. You had the April of 2023, the Collins Center report that Tim referenced. That was extremely helpful. Reports from the Interface Behavioral Health Referral Service. And then we pulled heavily from annual reports and recent community health assessments, all to inform our findings. So I'll walk you through some of the current operations in family youth services. They have experienced significant changes and adaptations, especially highlighted by its operation with the part-time administrator for quite a while. They are short the director, obviously, and there's a part-time counselor position that's been historically hard to fill, likely because of the pay and it's part-time. So the interviews we held revealed a range of perspectives on family youth services, with the common theme really being a need for more understanding about the department's operations and less directly involved. So during the pandemic, they were largely focused on connections to resources and referrals, and often time consuming due to the complexity of those cases. Behavioral health referral services through the contracted interface service have become key to the operation, with Doreen, from my perspective, going beyond her job description to be as responsive as possible while they've been short-staffed. She might even be on the call, so just huge shout out to everything she's been doing for the town. And while the town has been without the director or counselor, they've been contracting with the Family Success Partnership Group that's out of the Assabet Valley Collaborative on an interim basis. It's about 10 hours a month, and that's really just to try not to leave residents with no access to services. So again, the Collins Center report indicated that the department primarily provided referral services to residents seeking resources and assistance, showing significant shift from direct counseling services in recent years to more of a guiding role towards appropriate resources. That transition has been further facilitated by partnerships with various organizations to address some mental, community, and public health issues. I think that shift also reflects broader trends in service delivery within Northborough, where various town departments and regional partnerships have expanded to address the human and social services needs that have popped up. And I'll talk a bit about that. And it coincides with the shift we've seen across the state, with public health being charged with more community health and wellness related work, really since the pandemic, and in response to the nationwide mental health crisis. That leads us into the health department current operations. This department has shown really remarkable adaptability in light of this shift towards a more comprehensive understanding of community health, particularly in response to the unprecedented challenges of COVID and the migrant crisis. Not only have they stepped up to respond to those events, but they're following through with recovery initiatives like Be Well Northborough, Community Resource Guide in partnership with the library and other departments, the rebranded Encompass and Drug Free Communities work, and they're serving as the host for regional capacity building with the Greater Boroughs Partnership for Health. Recent expansions to their team, including a health agent, epidemiologist in 2022, and then a drug-free communities coordinator most recently in 2023, have enabled them to introduce and manage new programs tailored to the community's evolving needs. So there are activities such as home wellness checks, blood pressure screenings, Narcan training courses, all things they want to build on. And their management of permits, licenses, fees, coupled with successful grants totaling well over $500,000 a year, demonstrate a pretty keen financial stewardship that's going to be essential for the continuity and growth of the health program. So I'll get more into this later on, but it is important to keep in mind the health department grant funding is several times larger than its local funding. And this chart here actually shows town funding is somewhat low compared to the statewide average per capita. It's shown in the chart there. In terms of staffing, you have currently an interim health director who's also the shared services coordinator and epidemiologist. She's wearing a lot of hats right now. You have a health agent that's shared with the 3 other greater boroughs towns, and that's mostly funded by the grant. You have shared public health nursing, mostly contracted, and then you have the drug-free communities coordinator as well as an administrative assistant. Some of the recent initiatives and collaborations across Northborough's department and local organizations underscore a comprehensive approach already sort of forming within the community. And that multifaceted strategy not only enhances service delivery, but fosters a cohesive network of support for residents. So you have the police department working to integrate a jail diversion clinician, which would contribute to the crisis intervention and help those in need of the proper care and support, diverting them from the criminal justice system. This individual could also provide support to individuals experiencing a sudden loss or traumatic event. That new person is, we talked to the chief a couple days ago, about 3 to 5 weeks out. They're training now. They're a mental health counselor that's going to be shared with Southborough. And the chief also told us about a system that they use in Sims where they track overdoses, and then the DA's office on the other end connects individuals with resources. So another great collaboration on community health. The fire department's work addressing heavy clutter housing, which is some folks might know as hoarding, is an area of overlap with public health and the sanitary code and with mental health. Fire also takes the lead on emergency preparedness planning, which again, considerable overlap with community health. At the senior center, funds from the health department from a grant have facilitated regular office hours by a public health nurse alongside hosting health clinics. So those services play a vital role in ensuring seniors population's access to essential healthcare and information. Also remember, the senior center was the site of many vaccination clinics, especially through COVID. There's so much value in the collaborative efforts with the rec department to promote community health through physical activity, engagement in public spaces, which is a priority of the community health assessment. I'll talk about that later. But the rec department also works very closely with the youth population and is such a natural partner for health prevention programming and other human services work. Similarly, the library stepped into a pivotal role in community health through the Be Well Northborough initiative with their health and wellness coordinator and the development of the Northborough Community Resource Guide, which is pretty fantastic. And that's another department that has considerable interaction with residents day to day and would make a great partner for increased capacity on preventative programming and connection to resources. You have the DPW demonstrating a lot of adaptability and commitment through their logistical support of vaccination clinics and migrant shelter operations. And then you have local organizations like Helping Hands, the Food Pantry, Special Benevolent Fund that have been instrumental in addressing needs and filling those gaps. And then finally, I have schools here actively engaged with the Encompass and Drug-Free Communities program, further supported by a $100,000 grant that the health department wrote for the Metro West Health Foundation. And that grant aims to expand clinical support for students addressing an urgent need for mental health services and substance use prevention. All these examples represent the collaborative spirit, dedication to health and well-being that characterizes the sort of existing staff approach across departments. And by leveraging some of the strengths and resources of various departments, Northborough sets a precedent for comprehensive and inclusive public health strategies. This is my constant refrain for small towns. So across the municipal sector, small departments are extremely vulnerable for a number of reasons. When large-scale initiatives or unexpected events such as COVID or migrant crisis, departments can be quickly overwhelmed. A lack of diversity and skills within any small team can lead to isolation and silos, making it difficult for staff to cover for each other during absences or when there's turnover. you're not alone here. It's extremely common in small towns, but you know, over-reliance on indispensable individuals creates these significant operational risks. In terms of opportunities, there's a noted demand for behavioral health resources for especially the 18 to 65 age group, indicating a gap that could be better addressed. There's improved data management and preventative programming, including outreach and education, all areas where we could significantly impact the community. And there's a strong desire from town departments and local organizations for increased collaboration, especially on some pretty daunting community health issues. A focus on community health should be accompanied by pursuit of additional community health funding, which is certainly out there. And you've already proven to be adept with grant acquisition at administration. So while the purpose of this study was to bolster capacity within the existing budget, you could certainly revisit that and continue to grow the department down the line. The recent Metro West Community Health Needs Assessment has highlighted critical areas for our focus. So there's a significant need for community health services. A big cross-cutting issue is access to care. 1 in 3 can't access mental health services due to a lack of providers, long wait times, insurance barriers. 1 in 5 is dealing with depression. 13% report that their mental health was not good for half or more of the past month. We have 16.7% engaged in binge drinking within the past month. These are Northborough specific results. I should clarify that. The town received a very low walkability rating. That's a combination of factors: the presence of pedestrian walkways, residential density, street lighting, traffic conditions, that sort of thing. 26% are burdened by housing costs, meaning those costs exceed 30% of household income. 64% are eligible for SNAP benefits, but are not currently enrolled. All of this to say, you know, the findings reflect the community's immediate needs and I think illuminate a path forward. These are big issues requiring a collaborative and proactive approach to ensure healthier, more supportive Northborough for everyone that lives here. We also conducted a survey, like we said up top. We got great participation. I just wanted to highlight a few results on the importance of offering services for mental health support and substance use prevention was overwhelmingly acknowledged, with 74% considering it very important, 14% considering it somewhat important. So that's, I mean, if I see a number above 75 in a large public survey, it speaks to there being a pretty strong mandate. There was also strong community support, 65% for employing a social worker to help residents navigate the complexities of accessing health and social services. Again, suggesting community-wide recognition of the value of social work in enhancing public health outcomes. And then a majority of residents support using opioid abatement funds. So those are funds that the town will receive on an annual basis to subsidize positions focused on social services or community health. We also asked about the type of community health needs people saw and got very similar results to the Metro West assessment. Overall, my takeaway is a strong demonstration of support for community health and social services. Sorry for the text overload here, but I want to highlight some lessons learned from model communities I spoke with. So I'll go through them. In Needham, the integration of health and human services allows for a holistic approach to community wellness, encompassing mental health, public health, and social services. A key lesson here is the importance of a unified management structure under Health and Human Services Director to streamline decision-making and service delivery. And that they've found has really elevated the department in town and with external partners. Notably, Needham has been adept with grant opportunities to enhance their community health goals, demonstrating the value of a department-wide approach to securing resources. They also serve as a host for regional grants, as Northborough does, and leverage that capacity to pursue more funding. Hudson's Health Department exemplifies innovation, particularly through initiatives like the mobile food pantry and the strategic use of ARPA funding to address housing insecurity. These efforts underscore the importance of creative solutions in meeting diverse community needs. Plymouth's comprehensive approach, which includes health, veteran services, recreation, and disability services under one umbrella, provides a model for creating synergies between different areas. So they're very collaborative, condensed sort of approach to using opioid settlement funds, for example. They are partnering with local organizations, and I think that highlights the benefits of community partnerships in addressing complex health issues. Similarly, Nantucket's integration with the Nantucket Cottage Hospital offers a unique collaboration model between municipal services and local healthcare providers, enhancing access to care and coordination. That department's active community engagement through public forums on topics like food safety, immunization, mosquito prevention, all that really demonstrates the value of open dialogue and public participation in health initiatives. And then finally here, Southborough does not have a Health and Human Services department, but in our interviews, we heard many rave reviews of their Family and Services department. So I spoke with their director, and Southborough's investment in significant staff, including a director, an assistant director / counselor, prevention program coordinator, admin assistant, and interns, makes for a pretty robust structure to support youth and families effectively. And that supports a broad range of services and programs, from counseling and support to prevention and community education, illustrating, I think, the importance of diverse roles within the Human Services Department. And each of these model communities offers valuable insights into the benefits of integrating health and human services. So we did what we could to find a model that would weave in as many of those lessons as possible. Based on everything we learned from internal staff, local orgs, community input, and model communities, this is the proposal we've developed for a new Health and Human Services Department. So the proposed structure aims to consolidate and enhance current operations, fostering a more coordinated and comprehensive approach to serving the community's health and human service needs. I want to emphasize here, especially when we have the boards in the room, we're making no changes to the authority or responsibility of any of your boards. Board of Health, Youth Commission, Select Board. This is a recommendation to improve administrative efficiency given existing human and capital resources. So Board of Health would continue to provide guidance on the health aspects of the department. And we hope a reinvigorated Youth Commission would direct some of the more human services elements of the department's work. It's not a situation where one department is taking over another, because there's so much work they share. Projects like the migrant shelter or drug-free communities or opioid dollars, preventative programming around health and wellness. This unified structure would allow for a more streamlined and coordinated utilization of resources. So on the next slide, I'm going to walk through each proposed role. But you can see here, there's a director of Health and Human Services along with 9 supporting roles. It's 7.5 full-time equivalents, so some are part-time. And 4 of these are shared positions, shared with other towns. I've color-coded by funding source, and we'll talk a little bit more about the budget later. Green being the public health excellence grants. That's the Greater Boroughs group. Those are long-term, stable. As far as grants go, there's no sunset date for those. As long as the state keeps funding it in its budget, those are set to continue. They're guaranteed through at least FY27. So a very stable funding source as far as grants go. Yellow is town funding. Blue is drug-free communities funding. Again, very long term. It's at least 5 years, likely closer to 10. And then we have orange as opioid abatement settlement funds. We've proposed allocating 30 of the town's approximately 55,000 yearly distribution. In terms of hierarchy, we see the health inspector taking the lead on environmental health with a part-time sanitarian coming on board to support inspectional services, given that the director will not be conducting inspections. We also see the social worker taking the lead on human services topics, and they would be supported by a community outreach worker. And here we are praying for another Jocelyn from the senior center. We heard nothing but good things about her and the support she provides. So the new label here refers to positions that you would need to hire for. The priority being the director. I should also mention I have model job descriptions. My next step would be to write formal job descriptions, should you approve of the recommended model. The director here is the most important piece of the puzzle. It's something I asked all our model communities, what should we be looking for? What are the skills, characteristics? And there were really 5 things. Strategic vision, right? You have to be able to align departmental goals with the town's overall health and human services strategy, ensuring programs effectively meet needs. So you need someone who knows community health well and has good knowledge of public health. So they need both sides of health and human services. They need strong leadership skills to manage diverse teams, foster that interdepartmental collaboration, and engage with the community's external partners. They would need really great grant management skills, proficiency in securing and managing them. They'd have to be collaborative in their mindset, and they have to be adaptable, always committed to continuous improvement, staff development, and responding to really what we've seen rapidly evolving community health challenges. The social worker would lead human services work, case management, and program development. If you can find someone who has their independent licensure or could do, direct counseling, that's a big benefit to help bridge while people are waiting for services or in crisis. It is a tough market for that skill set. And the priority from our stakeholders seems to be making connections to services, not necessarily direct counseling. And then we have a community health or community outreach worker that would support human services work and focus on public education and prevention programs. They could also work on case management, much in the way Jocelyn does at the senior center. And then while you do have a contract with Salmon BNA for nursing services, and we aren't suggesting reducing those services, bringing up public health nurse as Northborough, or for Northborough, sorry, would allow for more sustainability, provide health screenings, vaccinations, as well as support for prevention programs and health education. And that's a position that would be mostly funded by the regional grant. And then the last new position we're recommending is a sanitarian. So while Kristen Black somehow fit in septic inspections, we don't see the Health and Human Services Director doing that as much as they'll be managing people, programs, and budgets. First, I want to show you what the current budgets are for health and family use services. I'll try not to get too much in the weeds here, but in FY24, family use services is at 184,000, health at 215. That's town funding. The grants for the health department are massive. We have the Public Health Excellence Grant, Greater Boroughs Group, that's 460,000 per year. There's a Drug-Free Communities Grant. We mentioned that's 125,000 per year. The Contact Tracing Grant covers decent chunkier public health nursing contracts, contracted services, and a few other things. That's 260,000. These are big grants, but there are more out there. Mass in Motion, BSAS, community health grants. Once you have the capacity to pursue these, there seems to be a real snowball effect for communities that take this health and human services path. And grants are a lot to manage, but it brings so many benefits to the community. Again, try not to get too into the weeds. There is a crosswalk of town versus grant funding in the plan. It's a bigger table. I want to emphasize that the town is being strategic about what's town funded or partially town funded to maximize the benefits to the town and sustainability of positions over time. So I also want to emphasize that this departmental budget increase from 399 to 402 is a less than 1% increase. And the reason for that is that our task was really to work within the box of existing human resources, financial resources to find efficiencies. It's not that I would steer the town away from putting more funding towards these, and you could certainly do that in the future, but this is our focus for this plan. On to implementation. So tonight's a great start for public education. The recommendation here is to continue promoting the findings and proposed model, answering any questions along the way. If successful, the warrant article would be approved at town meeting. And then you could form a cross-departmental implementation team. I think, important to lead with a collaborative effort from the outset and through the hiring process to ensure the new director would be a good fit. That's something folks felt pretty strongly about. And then with the new staff on board, they'd have some work to do in terms of aligning programs, policies, and procedures across the department. Longer term, it'll be important to track progress. So we've recommended some key performance indicators, and those are service utilization, so tracking the number of individuals and families accessing services, community engagement, measuring engagement through attendance at community outreach events, participation in preventative programs, feedback collected from community surveys. Another performance indicator would be staff performance and retention, conducting annual performance reviews, monitoring turnover rates, tracking completion of professional development opportunities. Grant funding success, certainly. Evaluate the number and amount of grants secured by the department, focusing on those that support newer expanded services, and program outcomes. So for critical programs like drug-free communities or mental health counseling, public health nursing, establishing specific outcomes to measure effectiveness annually, such as reduced substance use among teens or increased vaccination rates. And then we'd recommend an evaluation process with regular review meetings with department staff, critical stakeholders, getting community input from public forums, and then reporting back to town leadership, providing a regular report on the key performance indicator outcomes, and using those insights to continue to make informed adjustments to services, staffing, and programs. I think this model is a huge step forward, but it shouldn't end here. It should continue to evolve and expand as it needs to. Tim wisely suggested that we try to ground truth this a little bit. So to illustrate how a unified model would play out, sort of real world, consider a scenario where a health inspector from the health department responds to a housing complaint regarding unsanitary living conditions in a home. They note signs of severe mental health issues affecting the individuals and a need for resources and support. So currently, the response would be sort of fragmented with mental health components. There's a lack of integrated support and follow-up, and inefficient communication and data management between departments. With a unified model, you could have a pretty quick and coordinated response. That the health inspectors and mental health professionals would collaborate. They address housing and mental health needs simultaneously. You'd have integrated case management, right? Coordinated internal referrals that ensure comprehensive support and follow-up within that same department. And ultimately, I think better outcomes. unified services leading to better resolution of both environmental and mental health issues, improving sort of well-being overall. And Tim raised another good point when we had this discussion. What about when people refuse help? That is something that's going to happen, and obviously respect that decision while continuing to provide information and making services available should they change their mind. So the goal is for proactive engagement and education to help the community understand benefits, the availability of services, and the goal is to increase understanding, reduce stigma, and reduce other barriers to access. And just to wrap things up, there are significant areas where improvement and growth can happen. Integrating the health department and family use services, that's going to streamline services, foster a more coordinated response to public health and social service needs. It's going to leverage shared resources and expertise, identify or address some of the identified gaps, especially for that 18 to 65 age group, and bolster collaboration with other departments like police, fire, schools, library, senior center. Proactive approach to grant opportunities, so capitalizing on available funding opportunities to bolster the town's capacity, including opioid abatement funds, substance use prevention, with a focus on the social determinants of health. A unified department would be in a much stronger position to pursue a broader range of grants for supporting innovative programs and services. Enhanced outreach, so expanding efforts in mental health awareness, substance use prevention, and healthy living initiatives to facilitate early intervention and improve community health outcomes. Expanding collaborative efforts, like we said, strengthening partnerships within departments, schools, community organizations. Recruitment and staff development, so focusing on attracting mission-aligned, dynamic individuals through a collaborative hiring process. Emphasize staff development, cross-training to enhance service delivery and adaptability within the department. I think this makes this a more attractive place to work. If I were someone looking for a position and you had a department that was comprehensive, you had a team you could rely on, to me, that's a lot more attractive than I'm going to go become the only person for social services. Or, I think this is a win for recruitment and retention. And here we want to have all positions strive to meet sort of minimum credentials listed in the Massachusetts Blueprint for Public Health Excellence. That's linked in the report a few times. And utilize resources from the Regional Public Health Training Hub hosted by the town of Needham, as well as connecting with other family use services departments that exist across the region and the state. Financial efficiency and sustainability, evaluating the implications of the integration to ensure the sustainability of services, and coming back to that on an annual basis. And then a couple more: data collection and informed decision-making, develop robust data collection methods to track utilization, community health trends, and outcomes. I have some recommendations in the report of data you could collect. I know the department already has some ideas for the direction they would like to take that. And community outreach and engagement. So continue engaging with the community through surveys, forums, and direct outreach to understand the evolving needs and adjust services accordingly. That ongoing dialogue is going to ensure the department remains responsive to community needs and aligned with their priorities. I think that's all I have for you. I'm going to stop sharing so I can see everybody. And with that, I think I can open it for questions from board members, right?
Yep. We'll start with questions or input from the board. And by board, I will say both boards, both the Select Board and Board of Health. No particular order. So raise your hand. And Swati, if you have any questions or input, press the *6 on your phone. And to you unmute, I'll recognize you. If anyone has any thoughts, just raise your either physical or electronic hand.
Mitch?
Kristen Wickston.
Yeah, hi. So I was the liaison from the select board to the youth commission. So I did go to quite a few of their meetings, my first couple years on the board. And I know that one of the things that June, the former director, used to talk about was that she wished it was her department was more like Southborough. So I was heartened to see the comparison of this change potentially being more like Southborough. But it sounds to me even better in a lot of ways. And I mean, it would take a little getting used to in my brain, and I'm sure everybody else's, the reconfiguration. And I took a lot of screenshots so I can go back and look at them later and process. But I think I thought that was a really good point Connor made that if, well, a couple things, but they both related to having family and youth services be sort of alone in a corner and only staffed by one or two people, and how difficult that is if someone is sick and how the burden really is heavy on the other person. But also, if I were looking for a job, that is a really good point. Wouldn't you rather be part of this really exciting team? And I know our health department is really vibrant group of people. So, and they really have been doing the work of an HHS with everything that's been going on the last 9 months or so. So I don't know. I think it sounds fantastic to me. So what a great idea. Thank you so much.
Yeah, thanks, Kristen.
Thanks, Kristen. Comments or questions from the board or Tim?
Just probably maybe to start off, because I've been in this budget process for a couple months now. You know, the first time we did a appropriation committee meeting, police department, the library, senior center, you know, everybody, they didn't, you know, exchange presentation material ahead of the meeting, but thematically, there was a social service component to everybody's presentation, independent. So, you know, me, I'm new, I'm on the outside kind of looking in still. And I can see that there are people providing services to different segments of your population. And to have the collaboration, some might call it overlap, but, you know, those departments to provide those core service levels and social services to their constituency, if there's a breakdown inside the operation, there's really no crosswalk to help those folks if they break down inside their own department. So this, in my mind, was just a natural evolution of, we provide these services, we need them to wrap around and complement one another, and to have one department doing it while leveraging the fortunate position we're in for grants through the Board of Health. It just made a lot of sense. So I don't want to overly simplify it, but just from the outside looking in, it was pretty evident to me that you had an opportunity to make a shift to provide excellent social services under a model such as this. That's why I think doing it at the same time we were doing the budget, then kind of walking into those hearings and hearing the theme of providing services to the residents that are in need. It resonated with me, and it's anecdotal at best, but I wanted to share that with the board, that I kind of see it walking in the door. So it's very gratuitous that we're doing this from a timing perspective. I just want to share that little piece.
Julianne and then Laura.
Well, I'm going to ask one question, then I have a whole bunch, so I'll ask my one question and then let Laura go. But first of all, it was a great presentation and it was a great report. It's very complete. And I have to thank CMRPC and Connor for that. But Tim, don't go away for a second. I don't understand what you're saying about the need for overlap. So let's just say there's a situation with the police, they need a social worker, so we're going to potentially staff 1.5 positions of a social worker. They're not available, they're caught up with something else. Are you saying that a lot of these roles are interchangeable? I don't quite understand what you were saying.
Can I, Tim? I think what I found in our interviews with department heads is folks from the library, for example, are not equipped to deal with someone who's in a crisis situation. And they don't necessarily have someone that they can pick up and call for advice on how to deal with that situation. I think the same is probably true across most departments. I think library probably is encountering that the most because they're dealing with the public the most. But the same is true for the fire department if they are in a situation in a house with heavy clutter, like we talked about, or certainly with the police department. So I think what Tim was pointing out was having that skill set centralized somewhere will help the various departments collaborate on what has been a challenging issue. Does that sort of capture it, Tim? Yeah.
Yes, yes.
But it doesn't necessarily have to be this organizational model to you know, for the librarian to call social services.
Oh, I see what you're saying. Well, I think because you do have a bigger department, there are more opportunities for cross-training. So while you would still have, you know, a social worker and a community outreach worker, or probably your first go-to people, you would also have an administrative assistant who could assist with, you know, fuel assistance application comes to mind, or a health and human services director that knows, oh, if you're having this issue, there's actually a great private healthcare option for you in Worcester that I could direct you to.
Yeah, but those are not emergency things. Anyway, take any more of your time, but I will reserve the right to ask my further questions after Laura. Thank you.
Laura?
Okay, thank you. So I really appreciate all the thought that went into the study and the community outreach and the information that you've shared. I joined the select board in May, and I have experience working with family and youth services, both for myself and, you know, and folks in the community. It's hard, you know, to look at this from the lens that we have an unfull board of family and youth services. There's only, I think, 3 members right now. So that's really, you know, eye-opening. I know we lost 2 people recently because of the lack of staffing and staffing support in family and youth services. And it's hard, you know, to look at the challenges that we're trying to solve when it's been an incomplete board, an incomplete group or department within the town. I loved the Southborough model because they are keeping that group independent. And I was a little bit concerned about, you know, adding 5 new people with a director whose primary responsibility would be for grant applications. And that seems like a big, that's a big reliance on grants being approved for the town that we would be responsible for if those grants didn't come through. So adding all of these new people and the reliance on grant funding was also something that caught my attention. But ultimately, you know, looking at this model, the most important goal of family and youth services is really been the reliance and help for mental health. And I'm not sure that spending all of this money would help ultimately solve that giant need for our community. And so I'm just trying to understand, you know, or share my feedback based on the report and experience with it. So I'll just pause. That's just my first feedback on this.
So I can definitely speak to the first part of it, that you're concerned about a reliance on grants. It makes sense. I mean, you give up some autonomy when you're going for grant funding. But But to me, the pros far outweigh the cons. The amount of grant funding that's available that can support the town in various ways, as well as the programs that we're talking about, are not traditional grant programs where you get funding for a year or two and then have to figure out something else. These are long-term, and the town's been strategic about, keeping new staff positions tied to long-term grants. And then I might have to ask you to repeat the last part of your question. There was a concern about whether we're meeting the need.
Yeah, I mean, we haven't had a full family and youth services board, and we haven't had people in that department for a great deal of time, and it was historically understaffed. So when we're looking at that as the foundation to make these recommendations,
Sure.
I really wonder if it would be better just to really invest in what was identified by that board when they were full as what was needed for that department to be successful and to really serve the community.
Yeah, to that I would say, we are adding another position. So if you looked at the sort of business as usual staffing for family services, there's a director, a part-time counselor, a part-time admin. We're adding a community outreach worker. There's a director, and there's a social worker. So, and then a full-time administrative assistant. So I do think you get more than you would with the sort of current model. But like I said in the presentation, I would not steer you away from considering growing that more, putting additional town funds towards the human services element moving forward. And I see Isabella has her hand up.
If I may, so my name is Isabel, I'm the interim health director, and I just wanted to speak a little bit to the grants. So, and currently that's what I manage. So long-term grants are where we have our staff. So all of our, like our health agent, our shared service coordinator, even the DFC coordinator, they're all long-term grants. So we really can depend on those for 5+ years. These short-term grants are used for programming and contracted positions. So we're not in that position where staff are going to lose their jobs or anything like that. So we really look for these long-term grants for staff. Just wanted to clarify that piece, Connor.
Thanks, Isabel. Okay, Lisa Johnson.
Hi, Connor, thank you so much. It was really nice to hear you explain the report. I've had a chance to look at it a few times, but it's always nice to have a PowerPoint and the expert present it. So I've been on the board for about a year now, and I was appointed by Kristen. When Dr. Black appointed me, I had no idea of how incredibly talented she was. I wish the town could see what she did behind the scenes during COVID and up until the time she left with the immigration crisis. She took her time personally, and she's very much not a person that wants to be in the limelight about that. I remember last year at town meeting, I said, I wish I had stood up and thanked her. And she said, thank you so much for not doing that. Both departments, Family and Youth Services and Board of Health, have been incredibly understaffed for years. When Dr. Black stepped in around 2020, there's been a phenomenal change in advancements due to grant funding and the vision that she brought in. She brought in an epidemiologist. We now have the drug-free coordinator and so much more. So if you don't have an MPH lens, a public health lens, or you haven't been in the trenches, I can appreciate that it may seem a little odd to look at this model. But Julianne, I would invite you to shadow some of the crisis situations that our health agent and interim director see firsthand here in our town. This is not advertised, it's not talked about, but we have significant challenges that for the first time are really being handled in a proper way. And as far as Family and Youth Services go, Laura was talking about, well, let's look back historically and see what perhaps was recommended before. We're really trying to be proactive and to use evidence-based models to bring our town to where it needs to be to meet the needs of our community. If you look at the report and you read that qualitative, that rich information that our neighbors have provided, we're not meeting those needs. So look at the evidence to appreciate the health and human services model and give it a chance. Grant funding is extremely available. We're much more competitive when we are a health and human service model. We're already getting a significant amount of funding that's already made such a difference in this town. So it's really not costing our town anything. So I'd be really curious to see what people would think is anything negative going forward about this. There's nothing but real value to bring to our community.
Thanks, Lisa. Got a couple of comments myself, and we'll continue with questions from the board or boards. Connor, one thing that I always note is in the service opportunities slide, you don't have to bring it back up. You referred to the schools, really the 18 to 64 area as a gap. Another gap that is sometimes forgotten are kids during the summer. That schools really, our school departments here have a great program for helping kids, with mental health crises and things like that, which are certainly very prevalent among the youth. But that 2.5-month gap is a gap. So that's something that, I hope with whatever the form going forward is, that we'll have the capacity to plan for that and deal with that. One of the reasons that I do like this proposal is, in the current model, even if fully staffed family and youth services, the department head is also really the primary counselor. And there was this open position for a part-time counselor for years that was never filled. I like that we're taking the administrative role of that and splitting that out, so that the social worker that we would hire as a full-time social worker would be concentrated on just that, and additional adding the outreach worker, which is a position that doesn't exist now. I really like that for dollar, it's essentially the same total cost for both systems. We would have a lot more in what we would call family and youth services support role for the community. And then I have a suspicion that we have a lot of unmet need that we haven't even identified in the community because of the lack of staffing and maybe the way that the prior department was organized. Maybe it could have been better, and certainly having some outreach there. I would not be surprised if we adopt this plan, and especially with the outreach person, we may find a lot more than what we think there is. And maybe then it might be justified to add an additional person. Not proposing that now. It wouldn't shock me. It wouldn't shock me if we just sort of unearth that need. A question that I think was on one of your slides, Connor, the Youth Commission, which is an important committee, was the staff liaison for that was the head of Family and Youth Services. Would that now be the director of this new combined department? Okay,
Yeah.
so they would have a director level position at all of their meetings.
Correct.
Okay. And then the last question I'll ask for now, I may have some more in a little bit. Looking at health and human services models of other municipalities, I just sort of, did a search around, and I find a number of them have additional functions within them. It runs the gamut, but I'm curious if you see, based on what you've looked at so far, any advantage of thinking forward or disadvantage of thinking forward, of combining some of the groups that I see, oftentimes animal control, cemetery functionality, senior center even, and parks and recreation sometimes fall within health and human services. That's not being discussed now. We have not done any work on talking about combining them, but I'm curious, for municipalities our size, have any of them grown health and human services even larger?
So yes, but the qualifier from the model communities I talked to was always, if there was a challenge in moving to the new model, it was because there weren't position vacancies. You know what I mean? There was someone in a whatever it is, animal control that felt like they were now being put into and that created political difficulty. So, and I do this in my role at CMRPC all the time. If we're assessing, a regional shared service, something like that, the best time to do it is when there's an opening turnover. And yeah, I think it would be worth exploring those things if the opportunities arise.
Thank you. Dilip, you have your hand up.
Yes, thank you, Mr. Chair. I want to piggyback and echo some of the things that Lisa has mentioned. I've been on the board a little longer than Lisa has been. I've been probably on the board a little over 15 years now. And when I joined, there were only 3 people on the Board of Health. And we changed directions and decided to have 5. We finally got our 5th member a year ago, being Lisa. In the last 4 years, as I'm sure you all are aware, a lot of things have changed in our approach to public health, okay? Starting with COVID and its sequelae of mental health, illness. Of course, substance abuse has, gone up significantly. The migrant issue. So a lot of things that's hit the community in the last 4 years, which wasn't there in the previous 10 years that I've been on the board, and has not been significant. I mean, flu is there every year, it's a different type of flu, but that's been every year. But something like COVID that hit the community, hit the country, hit the state in such a variety of way, how Kristen and her team handled that, and, from vaccination rates, where we were one of the highest in the state of Massachusetts for being a model community for the migrant crisis. And then, before Kristen, yeah, some grants were being written, but not to the extent that she has written the number of grants that we have managed to qualify for somehow, being only a small community, and then to establish the boroughs, where we can leverage the strength in numbers, so to speak. So the last 4 years has seen a huge change from public health crisis. And, of course, school going remote learning, that didn't help the mental health of the kids, which unfortunately, I don't think we've seen the end result yet of some of that. You give it 5 to 7 years, we're going to see a heck of a lot more issues with that, whether it translates from drugs to significant mental illness, dysfunctional situations, et cetera, et cetera. So I don't think we've seen that yet. And I speak as a primary care physician, and Swati's a pediatrician. So you can get her input on that as well. We're going to see some of this going forward, and I think we need to have a very robust program to support that, because if we don't, all hell's going to break. Look, I hate to say that. Thank you.
Thank you. Other questions or comments from either board or staff that are part of this meeting before we open it up to the public? Julianne.
So, I went back and asked for the request for proposal on this report. And the request was specifically to figure out how to integrate these services. It was not what's the best model, should we do it? It was specifically for this goal. And, whenever you do these studies, I think it's always best to be as neutral as possible. And so there was definitely, I'm not a research scientist, but it seems to me that there was a little bit of a bias from the get-go. How do we get these 2 services integrated? And I just have some nagging doubts about some of the information. And So let me start. So the people who were interviewed were overwhelmingly staff and not a lot of residents. And you know, staff probably interacts with residents way more than I do, and they know a lot. But I think I would feel better if more residents had been interviewed. Seniors, new parents, that kind of thing. Also, another concern of mine is that on page 43 of the report, it says that a lot will depend on the person who's hired to be this department head. And that person is going to have some very special qualities. And, sometimes that works out really well. Sometimes it's not the right person. And then what? Also, I'm a little concerned with the models that were used. Needham, Nantucket, Hudson. Needham is twice the size of us. Their budget is, from what I can see, fact check me all the time, is 3 times our size. Nantucket is a very unusual circumstance. It's a seasonal economy. Talk about wealth inequity. I mean, people who live and work there versus the people who populate the island in the summertime. That's a unique example. So I'm not sure that it really applies to us that much. Southborough does apply to us. I think it's of the examples, it probably is the most similar, and they are not, they don't have an integrated HHS. And then I do have one question, and I'm really very concerned about this. The community health needs slide says that 64% of our population is eligible for SNAP. How could you just go over where you got that information and that data?
Yeah, so that's from the Metro West Community Health Foundation, Community Health Needs Assessment. I think I got the acronym right. So the SNAP gap is the difference between those eligible to enroll in SNAP and those actively enrolled in SNAP. So it's a number that often is surprisingly high to communities because the minimum to be qualified, I might need help here, is to be a certain percent below the median income. Is that right, Isabella? Yeah.
Yeah, and I'll just also clarify that doesn't necessarily mean that 64% of people are eligible. It's just of the people who are eligible, they do not have SNAP. So there's like room for improvement for the resources.
Okay.
I agree.
All right. And I just want to agree with Laura's concern that grants do have a time limit, whether it's a year or 5 years. And, in 5 years, who knows what the national economy is going to be like, and we have all these positions that we have to fund. And, we're not Nantucket. We don't have a robust budget. So these are my concerns.
Yeah, and to that point, I would, if you look at our, maybe I should pull it up, the funding source for the positions, if all the grants went away tomorrow, you're still left with something that's comparable to what you would have now without grants. I don't think that the math doesn't change on that.
A number of the current positions that we have in place now are grant funded.
Yeah, sure.
We're repurposing those existing grant funds for these slightly changed positions, if we adopt this plan.
Yeah.
It's not that we're looking for new grants for new positions. These are grants that we already have that are funding people. So if those grants go away, we're at risk of potentially losing those people currently, and that really doesn't change in this different model.
Yeah. And I know you, oh, sorry, go ahead.
But if the grants go away, we have these people that we have to pay their salary.
And that's no different than today.
We're not, but we have the grants today.
Correct. And if the grants go away, we could lose those people, or we would have to fund those positions through other
Right,
means.
that's what I'm saying.
Right, and what I'm trying to say is that is no different between current model and proposed model.
Right, okay.
If there's no objection, oh, sorry, Chris, I've got a key member of the audience I'd like to bring in a moment, but I saw Kristen's hand and Laura's hand, and then we'll do that.
Yeah, just quick. It just looks to me like, I know Laura was concerned that it wasn't as many people, but really the way Family and Youth Services was so isolated by itself, it was just June. They were trying to hire somebody for the other position, which was half-time. And her argument was that she wanted it to be full-time. It was still only ever going to be 2 people. So the way it looks to me now, I pulled up my screenshot of the new structure. There's the director of Health and Human Services, and then there's shared services coordinator. I'm not 100% sure I understand what that is, and then there's like all the health department people, epidemiologist, public health nurse, health inspector, and then sanitarian separate, which is genius because yes, I agree. I was like, why is Kristen Black inspecting septic systems? She knew way too much about septic systems in this town and for all the other things she was doing. But then on the whole other side, we have drug-free communities coordinator, we have clerical administrative, we have a full-time social worker, and then we have a community outreach worker. And that clerical administrative, I believe, is sort of what you were kind of, either the community outreach or the clerical administrative would be sort of the Jocelyn person. And you do want a really vibrant person for probably both those jobs, but basically you have both those jobs supporting the social worker, supporting the director, plus this drug-free communities coordinator person. It just seems like more people to me. That's all. So I'm befuddled if people think it's not as much help. It seems to me it's more help for the people who would be going to Family and Youth Services. That's why I am in support of this idea. It just seems like a more robust, I believe the term is, that the guy from the Board of Health used. It's just there's more support for the people who are doing the tasks, and there's more overlap potentially. So anyway, I'll stop. Thanks.
I just had a point of clarification. I saw 5 new positions listed if we move to this model. Did I misunderstand that?
I think I maybe misused the new label. So they're redefined roles, and we're not adding more to the budget to allow them. I mean, your sort of savings, I guess, come from combining the director positions, and then we're then able to add really one additional position, which you could maybe think of as the community health outreach. The community outreach worker is kind of the added bonus you get by doing a unified model. Because you're right, Kristen, that there are more people under this than there were under the sort of existing models.
And then this model would rely on, did I read this correctly, 846,000 in grant money per year?
So not exactly. There's 460,000 that comes in through the Greater Boroughs grant. And that covers about 3 staff, if I'm remembering correctly. And like I've said, that's a long-term, there's no sunset on that, unless the state priorities change, which is possible. And then there's the drug-free communities coordinator position, which is funded by a grant as well.
Thank you.
And again, those are people that we already pay. We already pay people with those grants. So those are staff positions that we've had in place for some period of time. And we'd be redefining with this. We wouldn't be anticipating new grant money coming in to support the positions that are proposed, correct?
Perfect.
Okay. Lisa and then Tim, and then I want to let someone in from the audience. Lisa Maselli.
Thanks. And I want to say, really, this is a great amount of work. I want to thank everybody for all the time and energy that they put into it. And Isabella, it's certainly your work that you have done since you've been interim. There's a lot of information to take in, and I'm not doing as well as I usually do in understanding all the information. First off, one of my confusion is that we're hearing that there's support coming from the library, coming from the senior center, coming from the police department, in addition to this new model, correct? Or is that that can't be part of the new model because they've already been there?
I think that having a new director and having this new structure will allow for that collaboration to improve and continue. But the sort of ethos among department heads is very collaborative now.
Okay, but right now we don't really have anything set at the library. The police are starting to share again with Southborough, and that's not coming in for 5 or 6 weeks, I think. Without for a while. The senior center is certainly wonderful, and on its own, I think that Jocelyn has been there for quite some time. The library is new. I'm not sure how degreed the people have to be in the library to be able to help. There's got to be some sort of if they're in the library giving advice, what is the advice? What's the advice? Is it limited to certain advice that doesn't get into a medical situation, that doesn't get into a HIPAA problem? It's hard to say that we have all these different things going on, but we don't have a department. We haven't had a department with people in it. So I'm not even sure, so many papers here just to try to ask these questions. I'm not sure what the actual result was from the investigation as to why this department fell apart in the first place. That I don't know. And as much as I want to have as much help for the community, because they absolutely need it, and I've not had to, luckily, avail myself of any of this, so I don't have any personal experience on going somewhere to find information and having the need and not being able to have assistance. I mean, that's a huge piece of, what we need to provide. I'm looking at here at one of these other pages, page 5 of 34, and in a few, food security is at 36.7%. That's huge. I mean, do we have, what are we doing for the food insecurity? I mean, it's not like you can take a counselor and make them feel better. You have to give them food, I imagine, or find some ways to get them food.
I imagine you could help them find resources. And that's something the Family Services Department traditionally has been responsible for. And that's, as you mentioned, those positions are vacant right now.
Okay. And I mean, but that's something to be concerned about. I mean, that's a big percentage of the population that's having food insecurities. And then with the hierarchy, I'm a little confused on the hierarchy as well. Are we hiring, you said not, we're not hiring 5 new people. I had the same question Laura had with, I see 5 new positions. We don't have a social worker, is that correct? That's
right now, no.
And we haven't had one for how long?
About a year.
A year or so, all right. And so is the social worker going to be working under the Director of Health and Human Services, or are they going to be equal, or how is that set up in the org chart?
Yeah, everyone in that department reports to the director, but that social services worker would kind of take the lead on human services things and be supported by the community outreach worker. So there is some hierarchy to that position as well.
Okay. And how is that person then integrated with the person that they have at the police station? The police.
So as I understand it now, the police will, if they encounter a person who's in need of services, we'll note it at the end of a police report, say we referred them to Family Youth Services, and kind of hope that that happens. I think the way that it would work moving forward is a much closer relationship between probably the jail diversion coordinator and this department to ensure that those follow-ups are happening and the resources are sort of being connected to. You had a point about the library that I made a note of. As it happens now, they do get a number of requests for assistance, and they have various sort of pamphlets that they are able to give out. I think the difference in this model is that they could instead hand off to a warm body, a social worker or community outreach coordinator that could hold this person's hand through, navigating the patchwork of services that are available.
Right. So if we stay with the present model, though, you could put somebody there a couple of days a week if necessary, right? So that they could refer them to go down the hall and this person will help you.
Say that one more time. Sorry.
If you stayed with the present model and if you hire your social worker or whatever your organization is that we don't have.
Yeah.
Then,
well, I think it would be hard if you have just a director of Family Youth Services to say, all right, we're going to pick you up from your office and you're going to go sit in the library and leave this area vacant because we just have a part-time clinician position that we probably can't fill.
But aren't we supposed to have a social worker? We just haven't had one for a year.
I will just add, Connor, just because I've been talking to other departments, the part-time position is very difficult to fill. The salary right now is not competitive. Westboro has a part-time social worker open right now. It's just not competitive. People want full-time, they want benefits. And I think that is making this model a lot more attractable to our department as well.
So does that mean that the grant money then pays for all of that? It pays for their benefits and everything else like that?
Well, we're not using grant funding for those positions, but for the positions that are funded by grants, yeah, their fringe is included in the grant funding.
Okay. I'm getting more confused. I'm gonna
sorry.
Back for a moment. Let some other people ask questions.
Tim, you've had your hand up for a little bit, and then I'll open it up.
Yeah, I'll try to be brief. I think there's two things. With any outside agency that's not skilled in providing social work, they would be a referral back to this department so they can hold their hand, like Connor said, to get them services, whether it's state or private insurance. So the library might be trained by these people to identify people in crisis or in need, but then depending on the questions they may ask, but there wouldn't be, Monday, Wednesday, Friday, somebody sitting there waiting for someone to come in. That just wouldn't be the model. The library has developed these pamphlets and it has a lot of catalogs of particular resources that they can hand a pamphlet to someone, but that's not the same as handing them to a person. So short answer is the library becomes a referral back to this department. And we got a little confusion on the grant funding and the money that's already budgeted. You already have $186,000 budgeted in Family Youth Services that is not being spent because there's no employees there to do this. And that's kind of what drove the idea pragmatically for the study, is because we have these vacancies and then we had the second vacancy with the health director, we thought this was a good time to study the model. Having said that, if Connor can bring the screen back up so we can talk about the funding sources, because I think we are confused about what's new, what's existing, which in that model that we have now, who's being funded by general fund and who's being funded by grant. And I know Isabella knows this better than anyone. So if we could just go through that so the boards can understand what those funding sources are for those positions, I think that's important. So I will ask through the chair respectfully if Isabella can run through these and just get the board better acclimated with what the funding sources would be under this model.
All right, so I guess I'll walk down. So the Director of Health and Human Services, that would be combining those two directors. So that would be town funded. Then you go down to the Shared Service Coordinator, which is currently part-time, so 0.5 FTE. That is through the PHE grant. Then the three positions underneath, the health inspector, the public health nurse, and the epidemiologist, those are also all PHE, Public Health Excellence grant funded. Again, this is a long-term grant. I know Kristen is on the phone and she's now the director of shared services. This is, again, a long-term grant. Many towns are part of this grant. Honestly, I would say more towns than not. The sanitarian would be an additional position, so that would be town funded. It's part-time. This would be, again, to help the health inspector because the director would not have that time to do inspections. Then as we go into more of the social services, we would fill a full-time social worker. Part of it, and I would say, I think it's about $30,000, Connor, would be from the opioid abatement funds. We use the survey data that people were very much in agreement that the opioid funds, at least part of them, should go to the social work position. So you have that full-time social worker position, and now this completely additional position, full-time community outreach worker, which is also just funded by the town. We're modeling this after the senior center because that position is so widely respected and utilized. And then we have the clerical admin, which would do 1.0 FTE, so full-time for the entire department. And I know we really haven't talked much about this drug-free communities coordinator, but this is a federal CDC grant that Kristen and I worked really hard on, and it kind of started these questions. So drug-free communities coordinator, does that fall under health? Does it fall under family youth services? Where do we draw that line? So health, we wrote the grant, we managed the grant, and we hired the position, but really substance use falls into all of these different departments. So really enabling that position to work with the social workers is another huge benefit of this position. So I think, Tim, did I answer your question about different grants?
Yeah, you went a little quick, but just when you model it against what we have now, the real addition comes from the two positions that director level now at Family Youth Services and the health director become one position for health and human services, right?
Yes.
Okay, and then under that, you're adding, if you just look at the 186 that the Family Youth Services budget is today,
yep,
you're adding really one full-time clerical administrative position when it was only 0.5 historically.
Mm-hmm.
And you would fill a social worker full-time where you haven't had any, but it was only funded at half-time.
Correct.
Okay, so those are the only substantive changes budgetarily. And the impact by merging both those two departments is $3,079. So from a dollar perspective, it's not a lot to bring it forward. So I hope it clarified a little bit of the questions that you had.
Just, can I go back a little? Because you're right. She was very quick. Us old people can't catch on that fast. The ones that I imagine were in the mustard color are the ones that are paid for by the town budget, correct?
Yes.
Sanitarian, the social worker, the clerical administrator, the outreach worker, and the director. We already take care of two of those four as it is. Is that correct?
In essence, yeah. I guess if you were to think of the social worker as equivalent to the June's position, and yeah, more or less.
All right, and the social worker's got two colors. So is that part-time social worker that you're adding?
No, it's subsidized by the opioid abatement funds.
So part of it's subsidized, okay.
Yeah.
And we still have to hire the sanitarian.
Correct.
And we have to hire a director for the health and human services and another social worker and a clerical. So that's 4.
Director, social worker, community outreach, sanitarian, and then the boroughs group wants to hire a public health nurse. That's in green here.
Okay. And So the community outreach worker, do we already consider that to be Jocelyn at the senior center? Or is she just able
No,
to?
she's separate department. She's just under the senior center and she serves the senior population. The gap for us is that 18 to 65-year-old population that really could use a Jocelyn.
Okay. We could all use a Jocelyn. All right. Okay, thank you very much.
Like to bring in someone we've spoken about a few times here. Former Director Kristen Black has offered to come in and say a few words and potentially ask a few questions. Kristen, if you could unmute, turn on your camera, and I guess identify yourself for the record.
Hello, everybody. Kristen Black, no longer of Northborough, but former health director. Can you all hear me okay?
We do.
Well, one, thank you for letting an ex-employee on. I know that's always a risk, but I'm here and I've been following this process and continuing to collaborate. I really believe in this model. And I just have to say, I sat in the position in Northborough for 3 years and I saw major inefficiencies in two directors. The two directors, I would go with Family and Youth Services. We would sit in the same meetings. We would leave the same meetings. We didn't know who was doing what because there was no clear lead. We go to the next meeting and you're paying two directors top rate to just be confused as to who's doing what. Like personally, I'm the type, poor Isabella had to work with me. I hate inefficiencies. And I want to deliver to the public, right? And so I think I just from the get-go, I would say to John Cordair, I'm really struggling. What am I doing? What are they doing? And he was like, this is the model, and John had so many direct reports, right? So there's many reasons of merging. I think number one is efficiencies. By saving the money of a shared director, you can now get some of these positions everybody's been asking for. I attended your ARPA listening sessions. I met with the public. I heard people saying, we want a social worker. We want a Jocelyn. We want an outreach coordinator. We don't have enough people to do the job. And it's so true. In some ways, from a purely health perspective, if I had my blinders on public health, I'd be like, don't do it. We're going to lose something. They gain more. Honestly, it's more of anyway, you can play the cards whichever way you want. The health, you're taking a health director who is half-time sanitarian and you're creating that as sanitarian. Now you're creating a higher level that can be efficient, that can walk into a meeting and have a big team. What we're seeing across the state in health and human services is major difficulty in hiring, right? We're seeing it in health departments and we're seeing it in social services. I know there was a question asked about the part-time social worker. That position has been open for, I believe, at least 3 years. So on the books, you have a part-time social worker. They weren't able to fill it. Even June back when, as the director, she was trying to get that full-time. I think they brought that proposal to you with ARPA. And I think by gaining the efficiencies in one director, you're getting that full-time social worker with the benefits. That's hopefully going to be really attractive. The other thing with just a standalone director of Family and Youth Services, Westborough's position, I believe, has been open over a year. You can go on their website. They've been struggling to fill. The town of Shrewsbury right now has sort of a nonprofit unique model. They're also trying to fill it. And it's just really hard to hire. And I think for anybody who enjoys their work and works collaboratively, and I think to be successful in the field of health and human services, you have to naturally be collaborative and want to be part of a team. And having two departments that I think, Connor, if I got your number right, have 8.5 employees, that's a team. That's something people want to be part of. It's going to set Northborough apart to be attractive for both great people in social work and great people in health. And I think really build amazing long-term stability for the town. I just think in general, we've seen major changes in the landscape of health and human services in the last 5 to 10 years. It's not the same landscape of when the Family and Youth Services was founded 15, 20 years ago. I think I just want to bring up 3 major changes that you need to be aware of, why this, why not? That's how it was before. One, I think opioid settlement funds, right? Every municipality is grappling with spending these funds and dealing with this horrendous crisis. And it is a multi-layered, process. There's no easy solution. Northborough Health Department, I was really proud that we started the naloxone distribution or Narcan training. We were giving it out. We were doing all that kind of work that could have fell under either. It's really a collaboration of both, and those projects would continue together. But the opioid funds shouldn't just go to health. They shouldn't just go to fire. They shouldn't go to just police or like social services. They need to go to a team that's working collaboratively. And I think I keep hearing in Health and Human Services this word that's not even real, like desilification, whatever that means, but you get the idea. We're all working in silos and we're not doing it well, and like really to be collaborative. And that's what we experience with Be Well Northborough. And I'm excited that this bill does. So I think the biggest thing is opioid funds are there. You're going to have to figure it out. That's on you guys. And I'm sure you'll do a great job, but this sort of gives you a structure for those two groups to work closely. And then drug-free communities, that's a new grant we received. I think it's amazing that we're seeing it. You're going to start seeing those differences with Emily in that role. And it, like Isabella already mentioned, like once we have that position, it's like 10 years or definitely 5, very likely 10. And it doesn't make sense to land in one or the other. And I think by joining, it's going to make that grant make sense and be effective and be in the library and be in the schools and really overlap. And I think the other update is, yes, we have a lot of public health funding. Those positions are there, that funding secure, as Connor mentioned. And I think I just want to mention that funding supports 320 municipalities out of the 351. So the majority of like 90+% of Massachusetts municipalities are receiving that funding. It's locked up and secured level funded for the next 3 years. I'm directing that group, hopefully way longer if I do my job well. And I think so we have that like new public health and all public health because of the investment under that PG grant to 320 municipalities right now. It's $24 million a year. We've never seen this kind of money in public health. It's big money across the state, and we're seeing major expansion in all health departments. Connor's working with like 3 groups, 3 different SSA arrangements or like PG groups. And they're getting it. They're doing things we've always wanted to do. They're getting into food insecurity. They're doing shared nursing programs. They're getting out and they're helping with hoarding situations. Like public health is expanding in Massachusetts for the first time ever. And so you layer all that, and I just think it's great opportunities for efficiencies. Recruitment and retention is a major problem statewide. I think being part of a team like this is exciting. It lets everybody like continue to learn. Nobody just wants to be just doing the same exact job and never collaborating and never learning. I wrote down like many things. I hope I touched on them, more. I literally leaving Northborough was a really hard decision. I'm like so happy to see all your faces. I'm really passionate about this. I believe it's the right thing. And when I left, I said, maybe the silver lining of me leaving is this will go forward because it's so hard to merge. I talked to my colleagues in other health departments that have done this. Needham, these success stories. I know they're not a perfect match when you're looking at the Nantucket or you're looking at Needham and it's bigger, but they're the matches that have done it recently and they're knocking it out of the park. They are the state leaders in this. And when I've talked to these health directors and I said, I think Northborough's trying, they're like, do it. If you have anybody leave, do it. It's the only time because it's so politically impossible to merge departments, to find these inefficiencies and to do it when you have people in the way. And I, I don't want to say people, it's personalities. They don't want a new boss. They don't want their position moved. And so I really look at the silver lining. Like, I hope this opens an opportunity. Tim will have one great direct report who's a, HHS director, and the grants know no boundaries of towns' departments, right? Metro West Health Foundation has been an incredible partner in the entire Metro West area. They provided many grants and they love the collaborative spirit. I think you'll be more attractive. It's more sustainable, for everybody. Because when I started in Northborough 3 years ago, we had 1.5, or, it was just me. It was me as a health director and a full-time admin. Oh no, yeah, one full-time admin. And there was, June as director, and she had a half-time social worker who like left soon after my start. And you had 2 departments total were 4 people. And right, we just couldn't do it. We were just stepping on each other's toes. And Connor just presented to you a proposal that would give a team to support your residents with 8.5 positions. Many of them already grant funded in place, but including those ones that everybody was advocating through ARPA. And it's going to cost the taxpayers a 1% increase. Like, I wished I lived in Northborough if this were to move forward, because my community's small and there's just no way they'd be able to get here. So it's what everyone's been asking for. And I really love working with all the volunteers in the community through the migrant response and the shelter work. And people were doing all this work for free. They were doing it on their time. We had no social worker. We had no outreach coordinator. And I really think, this is what the people have been asking for. And I think it's an incredible opportunity. And I really thank you for indulging me and letting me speak to this, but I really believe it's great for Northborough. And you guys are doing great work. And I think Connor gets the landscape. He's very modest. But Connor's been working in public health all over. He's really now the new public health person in the planning agency world. And I know we got the best deal ever with the amount of hours he put into this project and really asking those questions. And everyone's going to have a different opinion. It's hard finding the middle, but I think these are going to give you the bodies you've wanted. This is going to give you that outreach worker, the social worker that's full-time and attractive position on the taxpayers. I mean, it's amazing. It's a 1% in the bodies you've always wanted, and some stability, and hopefully something that you can recruit to and you can retain and you can build in the future. And the reality of Health and Human Services is, many of it is grant funded. It's just the nature of the work. If you go across the state and you survey successful departments that are doing it, they manage it with grants. It's just the nature of the work. But thank you so much for letting me talk about this project and your support. And I think your staff's doing a great job.
Thank you very much, Kristen. Before you go, are there any members of either board or staff that are on the call that have questions, particularly for Kristen? Okay. Other Kristen,
who has from time to time gotten credit for things that Kristen Black did. And I just smiled and nodded and thanked the governor very much. Anyway, not really, but somebody made a comment once and I think she meant you. But anyway, so I just want to make sure I understand. So we kind of have a perfect storm of missing department heads right now to make it easier to change the way these two departments work, because we don't have to tell anybody they don't have their job anymore, right? So that's just good luck. And then, so you think, Kristen and Isabella, that it fills the needs that the people, like this would be a better solution to filling the needs that the people at the ARPA meeting were talking about when they were saying that they really want mental health services in town? You think this is a good way to do that?
I mean, these are the exact positions. Everyone said we wanted Jocelyn. I work closely with the schools. There's always this gap, right? Like the schools let out, there's a break. There's no social worker. Like the Southborough model is beautiful. Like, right, they have a lot of people. If we took the current Northborough FYS model and tried to make it Southborough, we wouldn't be asking for a 1% increase of the budget. I don't know that you'd be asking for a 250% increase on the FYS budget. I mean, I'll let you run that, Connor, but I think it fills that gap. It hopefully will collaborate and offer that person who can offer continuity of services. When I worked there for 3 years, I begged and borrowed, and Jocelyn always said yes, but could you help me with this, Kate? Look, we just needed a Jocelyn, but we were asking too much of her. And, and she needs a backup and a partner. And, again, they're going to stay totally separate with this model. The senior center is separate. But I just think it really, in my opinion, for what we were looking for, what we heard in ARPA, I always heard social worker, I always heard outreach coordinator, and the former director of youth and family was doing some social work, but she was also going to all those meetings with me. Like, she wasn't full-time dedicated. So, you like the chairman said, you might need more, right? Like, you might get really into this work and realize you need one more social worker, but like, this is the step that for 1% increase across these two budgets, you can get a social worker who can be there to advocate, really assess what's going on, collect the data that was missing in that original Collins Center report, hopefully put it into a data management system, and then really give you guys the data for that 1% increase that you could say, do we need more? And that's a good question. I think you have to keep asking that. But those are the positions I always heard, was social worker and like a Jocelyn, like an outreach coordinator. But I'll turn to Isabella. Thanks.
No, I would absolutely agree. Thank you so much, Kristen. And I just want to emphasize that, this director role, the shared director role, is really freeing up that social worker and outreach coordinator to do the work for the residents, right? So they don't have to sit in those department meetings. They don't need to do fiscal budgets and reports and all the fun stuff. They can really be a social worker for the community. So that's 2 FTE, 2 full-time positions, totally for the residents. And I think that is, cannot be underemphasized.
Okay, thank you.
Thank you. Again, Kristen Black, thank you very much for joining us tonight. I'm going to send you back to the attendees. If you have anything else to offer later, feel free to raise your hand. And let's see, this being a public hearing, I'm going to start to open it up to members of the public. First, we have Scott Rogers. Scott, if you could unmute, identify yourself, and let us know what's on your mind, please.
Yeah, thank you. Good evening. Scott Rogers here, 26 Tomahawk Drive. And I think my comments extend what Kristen Weckstedt has said earlier in the evening, is when I was on the board and served as liaison to the Youth Commission and was working with Youth and Family Services and also with the Health Department and the Board of Health. I saw the comparison, and for the folks on the Youth Commission, they really struggled in that they weren't connected with the other boards, committees, and commissions. They weren't really connected with other staff and with other departments, like I saw with the Health Department and the Board of Health. And so I saw that stark contrast in how they really were struggling to get the resources they needed to staff the positions that were open. And so the comments that were made earlier about their needs really weren't getting, or what they were trying to accomplish, they didn't have the connectivity and they didn't have the resources. And I think an organizational change like this that's being proposed really establishes that interconnectivity, not just within a combined health and human services, but really brings it working across all the other departments as well. You've got a director of health and human services that will work and be focused on interdepartmental liaison and interoperability. And as was just mentioned, and I can't say anything better than Kristen Black would, it frees up those other roles to be full-time positions able to offer the services that the town is looking for. So I think, often we talk about win-win situations. I think there's about 4 or 5 wins here in this new model, in that all the things we've been looking for, going back in my experience, 5 years, and what I saw at the very beginning, I think this solves a lot of the issues that plagued us even before the pressures of COVID, the things that were needed prior to that time. So this in my mind is absolutely the right direction to go, and gives us a chance to provide the services that needed and attract the staff that's going to be able to provide those services. So thank you.
Thank you, Scott. Next up, we have Erica Zeiger. Erica, if you could unmute, identify yourself, let us know what's on your mind, please.
Hi, good evening. It's Erica Zeiger. I am Erica Zeiger, 2 Stratton Way. I was on, or still am on, the Youth Commission, and I have roughly 30 years of experience with social services. So I just wanted to kind of had a few key points that I'm curious about, mostly with staffing. So one of the things I'm getting from this is, so I feel like mental health is being used as a broad range instead of actually splitting it into 2. So the collaborating organizations, the rec, the library, they are excellent. And the Be Well initiative is just that. It's the current organization's collaborative. They put it in a booklet and then it goes to anyone that wants to pick it up in the library. But it's typically for someone that is well and not in crisis. You know, maybe they have stress over a lot of different things, but they are not in crisis. So I feel like we need to take those two and look at them differently. So one of my first questions is, you don't have to answer this, but one of the thoughts I have is, you know, would the Director of Human Services have direct experience in family and youth services? So they're going to be supervising this person. Would they have an MSW? Would they have worked social services? Would they be able to triage if someone came in and needed immediate assistance? That to me is different than me wanting to, you know, join a book club or go to yoga or take some self-help. That's different, that crisis situation. So I didn't really hear that discussed too much. I think Julianne mentioned it. So that's one of my concerns, is that this new department is going to be focused on public health, which is incredibly important. And I think we have a great health department, and I've been very pleased with everything that I've seen, just as we have a great counseling center. The social workers and counselors at the schools are fantastic, but they don't meet that need of 0 to 5 and over 65, and then the gaps. The social worker, I don't see how it's possible for one social worker to do the counseling. I know they have the outreach person, which I think is great. I don't see how one social worker could do counseling, help the police and fire if needed, and case management. So that's either model. I just don't, I don't know how physically they would do it. And that would be, they would, you know, let's say they took their summer vacation, they're off for a week. Who would fill that gap? Would it be the director? I really doubt the sanitarian is going to be able to do that. So while I see all these positions, and they are needed positions, please, drug coordinator, you know, they are needed. So I'm not saying that they're not needed, but I don't see how they can fill the need of a social worker or even an outreach coordinator, because it all begins with the outreach coordinator to get those roles started in those classes and things like that. So my first point is separating the two from your crisis to your, you know, Northborough's a great place. We've got an awesome rec department. I've used it frequently. I love the schools, but it's not crisis. And then ensuring that the Director of Health and Human Services would be able to interchangeably do the job of the, maybe not of the social worker, but would have experience, would be able to triage a family coming in with a major crisis or even a minor crisis. Excuse me for 1 second. My family was getting a little rowdy out there, so I had to slam the door. So I apologize. So the social worker, Director of Human and Health Services, I'd like to see them to, you know, almost be interchangeable for it to work. And I think I had one other thing. I just am looking at my notes. Southborough, I agree. Their model is fabulous. I wish we could do that one. And I understand the budgetary requirements, but I would clearly pay more than 1% in an increase if we could have dedicated hands-on time with those in crisis. Nobody wants a booklet. The majority of us that have worked in social services or even trying to find social services for our own children, or even for ourselves, it takes the entire day. You have a list. Maybe you got counselors from your pediatrician, and you call and you call and you call, and you're lucky if you get someone to answer you. And then if they do answer you, they either don't take your insurance, they're not taking new people, or it's really hard. And I would bet a lot that the people that are saying mental health are talking about counselors that can see them after hours, not when the kids are in school. And I don't know. I mean, I think the model is great, but I just don't think the staffing is there yet. And during, this presentation, I heard a lot of benefits for the administration, the staff. I've heard public health mentioned many, many times, but I don't think I heard hands-on, boots on the ground counseling for the families. So that's kind of my thoughts on it. I don't know if anybody, had like anything to add to that. But that's
Well,
my concern.
Okay.
yeah.
Thank you, Eric.
Do you mind if I?
Sure, please. Thank you.
I totally agree with you. Raise a good point about the size and scale of the challenge in front of these social workers is massive. It's bigger than any one town. And even if you had 2 social workers working a full caseload, that's 40 people or something that you can serve in town. You're probably still not meeting the need. But I agree, more resources would be better to get more of that assistance. And yeah, I'll just reiterate, I think this model is a first step towards that. And I think to Mitch's point, this is something that should be reassessed and could potentially be added to over time.
Thank you.
Yeah, thank you so much, Erica. I just want to echo what Connor is saying. So basically, here we are. There is no perfect solution. We can't solve the world with one meeting or one vote. But this is the first step that we need to take to increase our capacity. So, right now our only options are to repost that full-time director and that half-time social worker, or we can, go forward with this model, have the director, and have a full-time social worker and a full-time outreach coordinator. Those are really the options that we have. Neither one is going to be perfect. Neither one is going to do all of the work for the residents. But again, taking that first step and going into this with more capacity than we ever have. And also, Erica, to your point about, should the director have that experience? I mean, it is so important, but as Kristen Black said, like, we were on, the front end. We went to the shelter. We didn't know exactly what to expect, but we helped them to the best of our ability because we didn't have any staff. So I think that experience has really helped the health department understand the value of social work and social services. So I'll just end there. Thank you.
Thank you.
Thank you. Next up, we have Mary Ellen Duggan. Mary Ellen, I'm bringing you in. If you could unmute, identify yourself, and let us know what's on your mind.
Hi, everybody. I'm Mary Ellen Duggan, 47 Fisher Street. I have to support this proposed model for our Health and Human Services Department, having worked with both departments closely in many roles that I've had in the town throughout the years. What we have now is nothing. We're contracting out for our family and youth services, for our social work. We have nothing. We haven't been able to fill the role. With this proposed model, we will have 2 full-time people to do that triaging and to service people if they are in crisis. We will have the community outreach person, the Jocelyn that everybody wants for everybody that's under the age of 65. We will have a full-time social worker. Those are the 2 people that will be doing the triaging for our families in crisis. It is great that we have all of the supports in towns. Our town is amazing. We have, Helping Hands. We have the food pantry. We have the friend fridge. we have so many people in town that want to help, but to have this overarching, robust model would just benefit our town immensely.
Thank you very much. Tim?
I just listening to the discussion, I don't want to tell on ourselves, but for a year, time before I got here, the Board of Health was triaging these calls. And then we asked Doreen to come back, I think maybe in January, and she's been helping us for administrative level triaging those calls. So it's not like we're totally devoid of providing the service. We're not providing it very well, in my opinion, but no call is going unanswered. It's just not as good as it could be if we were to make a change. So that's just so people understand, we've been limping along for a long time, and this proposal, the way it's laid out, is so much better than where we are today. But I think it's important to note that no one, well, I can't say no one, right? I don't know everybody. But people that have reached out to us, we've tried to provide a conduit to service for them. And we just want to do that better. And we think this model is the best way to do that.
Thank you, Tim. Connor, I have a question that just came to me while the prior callers were speaking. Interface is it's an important referral service that we've had. I see that in the current Youth and Family Services Department budget. I don't see it called out in the proposed budget. Is it still there, or is it being removed?
Yeah, it's a $16,000 contract, and we're proposing to keep that the same.
Looking to see where, oh, it's as interface. Okay. Okay, now I see why, because that's an image, so I couldn't search on it when I was searching for interface. Okay, thank you very much. Other questions from board members, staff, or public? Okay. Julianne.
Is there anyone else from the public? Because I don't want to take their time.
There are no other public hands up. The next step, if we see no other public hands up for a couple of minutes, we will close the public hearing, and that cuts off that level, that type of discussion. So if you're in the public and want to add anything, whether it be asking questions or making a statement in support or opposition to the proposal, please raise your electronic hands. Julianne, I don't see any.
While we wait for the public, I do have a question. Do we have job descriptions for the Director of Health and Human Services, for the Shared Services Coordinator, for the community outreach person? What are the qualifications you're looking for in these people?
Yeah, we have models from similar communities. We're waiting until we sort of have your blessing to move forward with full job descriptions. But I can tell you, the director, for example, you would want a master's in public health with a number of years experience, especially in the, as Erica pointed out, in the community health and mental health field, as well as having knowledge of public health. The social worker, you would want them to have at least an MSW, preferably their independent licensure, so that they could do direct counseling. The community outreach worker, you would want to have a bachelor's at least in a related field. And the thing that, so I've hired a few throughout the Central Mass, and a strong connection to the region is actually something that's been very beneficial. Knowing the resources or having worked at a area nonprofit in the past, Tri-Valley comes to mind, or an organization like that. And then sanitarian, you need certain certifications to be able to do septic inspections, that sort of thing. Were there other ones you were curious about?
No, but I do have to say, Erica brought up a really good point of all the people on this org chart. Really, the only person who can provide direct services in terms of counseling and that sort of thing, is the social worker. And you talked a lot about overlap, but if it's Sunday afternoon, I mean, are people, you know, is this going to be a 24/7 service that we're offering? What?
No,
There's so much that I'm confused about.
yeah. So, I mean, the best way to make use of what are sort of limited resources, I think, are making the connections to the existing capacity elsewhere, right? Using your partner organizations to the extent that that person could provide a bridge service. If there's someone in crisis, you definitely want them to be able to do that. But like I said, even if you had that person dedicated to having a full caseload, a caseload for a social worker is seeing maybe 25 people at a time. I'm not sure that that's the best use of a public employee's time, given the sort of constraints we're under here.
Okay, so I promise one more question.
Sure.
Let's just say the social worker is on vacation and the director handles something, the director who's may or may not have a degree in social work. What is the town's liability if it all goes badly?
Well, you also have the benefit, we haven't talked about this much, but the new mental health counselor for the police department. So there is, you know, some overlap in that sense that that's a person who could provide direct services. But in terms of liability, I mean, I don't have a great answer for you right now. That would probably be something we'd have to ask your insurer about. A lot of towns have, I mean, you've had this before, someone providing social direct counseling, so I can't imagine it would result in a change in that. But I think you raise a good point that those roles would have to be clearly defined so that people aren't, you know, swinging outside of what they're supposed to be covering.
So I think right now, our current model, even if it was fully staffed, does not provide 24/7 coverage. So we're not proposing increasing that to 24/7 coverage. If it turned out that that was a community need, and at some future point we wanted to budget for that, Connor, which of these two models do you think would make more sense for something like that, existing model or proposed model?
I think something unified is easier to scale up, certainly, that they would have a culture that they could step into and have a team to work with, like Kristen said, would be helpful for recruitment, retention, and building a sort of culture within the department, so you can meet the needs that, you know, the community's expressed.
Thank you. We do have another member of the public with hands up, Jacob Jones. Jacob, I'm going to bring you in. If you could unmute, identify yourself, let us know what's on your mind, please.
Good evening, Jacob Jones, 106 Green Street. Thank you all. Hopefully make this quick. I appreciate especially the select board members' questions. They've helped me understand this a lot. I particularly appreciate our town administrators' clarifications. Those simplified a lot of things. I just have a quick set of real clarifying points. I'm not trying to oversimplify what is a very complex model change, but these are things that are maybe important in my little brain here. One, the proposal removes a position for the health director, which is currently filled in an interim position by someone we've heard from today. Two, removes a youth services director that is unfilled, creates in effectively place of those a combined director position as been described, assuming that all the positions currently and in the proposed model were filled, and assuming that all the grant assumptions are valid, the change to the proposed town budget, as I think the administrator said, is about 3,000, which is, I'm looking at pages 53 and 54. from about 399 and change in the combined budgets existing, even though that's not all being spent, but assumed everything was full to assuming everything is full, to about 402,735. And if someone, my question is to the boards, if someone could confirm those understandings are correct, I'll finish my comment. That is, I'm generally going to be, as just an ordinary taxpayer resident of the town, I'm ordinarily going to be quite skeptical of things that increase the tax burden. I'm ordinarily going to be in favor of things that decrease the tax burden. I view this as fairly neutral. And for something that's fairly neutral, my view would be I'm fairly neutral about it and would defer to those who are experts here, which we've heard from the current interim director, being in favor of this kind of change. And so my inclination would be in favor of deferring to those kinds of recommendations. And that's all I have to say. Thank you.
Thank you, Jacob.
I can just confirm that, yes, you had all that right.
Thank you. Any other questions or comments either from, okay, Lisa Maselli?
Hi, I just wanted to, I know it's probably I've asked a few times, but we've had difficulty filling these positions. How does this model change that? How does that make us more desirable? And do we have people waiting in the wings to take these positions, or are we going to have the same wait and difficulty finding somebody to fill them?
Yeah, I mean, you're operating in the same market, certainly, but I think you're making positions that are a lot more attractive, especially to people that are in these fields. You tend to have people that are more mission aligned, that have a draw to doing this work and want to work collaboratively in a way that's in line with community needs. I think just the fact that we're having a lengthy discussion about this speaks to the town is a place where you would want to work if you were in those fields. I had another thing to say, but I lost it. Yeah, I think if I were someone looking at applying for a social work job, for example, I would much rather be a part of a team than be the only, sole department head in charge of all family youth services. That's a lot of pressure on an individual. At least that's my perspective. I don't know. Isabella, you want to add?
Yeah, no, I would also add the way you showed the budget was really helpful. So so the counselor, that part-time counselor, is the salary's extremely low. So Connor brought it up to kind of like the market value. And same thing, so the social worker and the outreach coordinator. So those are, good competitive salaries, and also you get those benefits and the experience of collaboratively working with all of the health staff, all of the family youth staff all in one. And then you also get the professional development experience, which is critical. So, as a young professional, I'm going to go to a town, a health department that, they are moving forward and they are looking to broaden their reach, really. So these grants, they look good for new applicants and people who want to, define their career in local public health. So this is a good thing.
Okay, and those grants are going to cover those raises in those two positions. The grants will cover the raises in those two positions.
Which two positions?
So they're offsetting funds elsewhere. It's gets complicated when we get into how the budget breaks down exactly between the grant positions. I feel like I caused more confusion when I tried to explain it. But yeah, we've looked at, and thanks Isabella for reminding me of that. We looked at market comps for all the positions and set them at a rate that I think will be more competitive. And having those increases, we're still within that 1% total increase that we talked about, if that's your question.
Is the 1% from our budgets, from the town budget?
Yeah.
So you're increasing the town budget. And what is the actual amount of the 1%?
It's $3,000.
$350,000?
$3,007 is the added increase. And just for scale and perspective for these two, if I may, Mr. Chair, sorry. You have budgeted for the two positions right now, $208,000. We're no way going to pay the director $208,000. We might, but That's not what's budgeted. That's not what we think the market is. But so when you have that merged position, you have savings reduced out of those two line items. It allows you to do other things throughout the budget. So just in terms of perspective, there's 200,000 and change budgeted for both positions in the current model. Moving to the new model, it's a lower number. Of course, we don't have the position description yet for that position, but we know the market rate. Correct, Connor?
Yes, there are comps in the report.
All right. I don't, if you have it, if the board wants to know it, if you.
Yeah.
Okay. Lisa Bennett Johnson and then Julianne Hirsch.
Hi, Lisa, did you get a copy of the report that Connor put together? It's fairly long. He very clearly, and this is for the residents who are listening, this report is available to everybody. I'm sure it's online. If you go to Northborough.
Yep, it's under, town
Probably.
news.
I say probably Mitch could help me with that. I don't know how to find it online, but I know I have it right here on my desktop. Page 52 and page 53 compares the current to the proposed budget, and then you can see the increase of 1%, about 3,000 some odd dollars. And it just breaks it down really nicely. And you can see what the grants will cover, what the town budget's going to cover. And it takes a little while to, kind of chew on it to figure it out, but that might help, especially for those who are listening that may not have any access to these documents right now. And a lot of this does seem overwhelming. It's really clear in this report.
Yeah,
thank you.
That and I really hope the public does avail themselves of this, since they're going to be the ones who are then going to have to make a decision with even less time involved than we have. So I think that's a great report, and I don't know how we could get it into everybody's email. That would be lovely. So, thank you for that.
I think I don't remember if it went out because it's on the main town news page on the town website. It may have gone out through the townwide distribution email system, but for those looking for it, since Lisa has suggested, go to the main town website, which is town.northborough.ma.us. At that homepage, you should default yourself to the town news section, but if you're not, click town news. Currently, as of the time of this meeting, the second item down is Northborough Health and Human Services Strategic Assessment Report. And that will bring you to a short page that has a link to a PDF and that PDF is what we've been referring to here. And that's a 75-page PDF, and everything in Connor's report is from that.
And will that also be with the town warrant when they come to town meeting?
I mean, the 75-page item wouldn't be printed for town meeting, but it would be one of those backup items that people are referred to for, to look in advance. We print the warrant with a little bit of backup information, and then there's always the very detailed PDF reports from appropriations and financial planning and all of the other departments that are available electronically. I don't know if we have, a small number of copies at town meeting, but we don't print all of those out for all people.
Okay, thanks.
At a cost. Okay. Julianne.
So I'm confused about the money. If this does not pass town meeting, are you saying the budget is going to go up if we fully fund family and youth services? I mean, those jobs are available. They're in the budget now anyway, right?
Yes, they budget. If you keep the model, if this doesn't pass, the budget has the money in there to do current model or new model, just the way your budget is set up for, you don't do a line item budget, you do it in sections. So the whole lump sum will be as if it was going to be existing model, but once we adopt the code section, we'll be implementing that section of the new code with the dollars that were budgeted at town meeting or approved at town meeting.
Okay. And second question, are these jobs going to be mandatory come into work, or are they going to be remote? Mandatory come into work? Isabella, you?
I would say that it's, again, it's up to Tim, but we're trying to figure out office space as well, so we need to figure that out. Tim, I'll defer to you.
Yeah, I mean, we're going through the logistics. If it were to pass of where we fit people, we can fit people now. It's, you guys know the space very well. It would be tight, but yeah, the short answer is yes. I want people in this building to provide service to the public as they come in, and to still to work collaboratively. So that's the main goal, is to have them in the building.
Okay. And thirdly, there seems to be, you know, this amazing amount of grant money out there now. Would you say that that is because of COVID and the state and federal government realizing that they had to start pouring money into, you know, the pandemic and the after effects of that? And how do you assure us that when these grants end, that there will be this robust amount of money?
Yeah, so there's one grant that I think you could make the case for that, the contact tracing grant. That's sunsetting in another year.
FY26.
Okay, thank you.
And that currently, sorry, Connor, that currently has no staff. So that's just all contracted work, just projects, all the supplies. So we do not have any salary staff on that grant right now because we want to sustain our staff.
So you're able to use it for something other than contact tracing?
Correct. Yep. It's nursing, epi. It's, you know, grant money to sustain our work for pandemics and infectious disease.
Okay. Okay. So yeah. So but back to the question, if, you know, once hopefully the after effects of the COVID are over, how do you assure us that these grants will still be available?
Yeah, absolutely. It looks like, yep, Connor froze. So he'll come back, but the PHE grant, so that 460,000, which is most of our staff are paid under that grant. That's the grant that Kristen was talking about. So that is a long-term grant. It already is extended for 3 years, and almost every single town is part of that grant. So it's not it's not a factual of COVID. It's more that we are the only state that does not have regional health departments. We are the only state that has local health departments for each town. So that's the way the state's blueprint. It's their long-term plan to increase regionalization in the state. And then the drug-free community grant, which is through the CDC, is not based on COVID at all.
Yeah, and I would say the other programs I talked about existed before COVID. The big chunk, the almost $500,000 grant that's coming through. Massachusetts was the only state in the country to not fund local public health. Yes, COVID woke them up to we should fund local public health, but I don't see it in a reactionary way that they would switch back the other way. They have 320 towns relying on this as a significant part of their budgets now. And again, with or without this model, that's the situation we're in.
Yeah, but funding is always unpredictable, right?
Well, we do have it confirmed for 3 years, so that at least gives us 3 years of this possibly new kind of department, possibly, and then DFC is at least 5 years. So those are pretty long-term grants. We don't typically apply or, again, put staff on a less than 1 to 2 year grant because those are, you know, as you said, unpredictable.
Mm-hmm. Okay, thank you.
Lisa Bennett Johnson, and then we have one more person in the audience that I'll go to after that.
I just wanted to make a comment about grant funding, because I have probably for a good decade of my career, I had my position in research tied to grant funding. I can appreciate that, yes, the money is based on grant renewals and sustainability, but I think there could be some confusion as to this impacting taxpayers. Grant funding is either federal or state. If it stops, those positions stop. It doesn't look like anytime soon those positions will stop, you know, assuming the best and not the worst, but none of this is tied to COVID. So I just want some caution as we use that conversation, because it's almost, it's almost misleading. So, you know, the fact that we had the talent of Kristen, who had a background in being able to seek grant funding and knowing how to apply for grant funding, which is a skill set all in itself. She has that ability. Isabella has that ability in bringing people into, you know, the community that can support that is going to make a difference. So we'll have grant funding most likely for a long time to come. And, you know, God forbid we don't, then it's not on the taxpayers per se. So that was my main point.
Thank you, Lisa. I'm going to recognize from the audience, Doreen. Doreen, if you could unmute, identify yourself, let us know what's on your mind, please.
This is Doreen. I apologize. I am not a resident of Northborough, so I won't be giving you my address. I would like to put a voice to FYS. I worked for Family and Youth Services for 2.5 years. I left this past August, and one of the main reasons was because we had not been able to fill the part-time counselor position. So aside from counseling, I ended up doing my job as administrative assistant part-time, along with the other tasks that social worker would have performed. And yes, I have to admit that June's vision would have been to be another Southborough. But in looking at the proposal that's been put forth, I have to say that I'm really very impressed. And my big concern, I read through all of the responses for the town survey. And the thing that really struck me was the number of people who responded that said that they didn't either know Family and Youth Services really existed, or what services they offered. And the concerning part is we do have a presence on the town's website, so you know that the people aren't either getting onto the website to find out. The word's just not out there, and I'm really concerned that once the word does get out there, there are going to be so many more people who are looking for these types of services. And as you know, there is no Family and Youth Services right now. So at least as many people have said, with this proposal, it's going to be a great start. Having a full-time counselor, having an outreach person, having a full-time administrative assistant. It's more than what we had dealing with all of the issues that we did for the last, since I was there for almost 3 years. The other thing that I want to clarify is when you're talking about counseling, number one, we have Interface, which has been certainly filling a need. The other thing is the counseling doesn't necessarily have to be one-on-one counseling. A lot of the townspeople voiced their opinion that they wanted more in the way of support groups, so it could be counseling in that manner. But there needs to be another body that's out there that is helping to coordinate support groups, whether it be with the schools, whether it be, after hours, held wherever the town decides. But the need is really great. And like I said, one of the reasons I left is the job for me just became very overwhelming. And you really need to do something. You really need to do something soon. And like I said, I'm really impressed with the proposal that's been put forth. And I think it really is a great way to start. Thank you.
Thank you very much, Doreen. Really appreciate your insight. I think it might be a good opportunity to consider closing the public hearing. I'll give it one more chance if you're in the audience or the attendees, as Zoom calls it, and you have anything else, you're welcome to raise your virtual hand. And if we don't hear anything, I will entertain a motion to close the public hearing. It does not close it from the people that are on the meeting. We can still do one more round before we take some action. Seeing none, I will entertain a motion to close the public hearing.
Mr. Chairman, I move the board to close the public hearing.
Is there a second?
Second.
Okay, motion made by Lisa, seconded by Laura, and possibly others. Any other discussion on that? All in favor of closing the public hearing? Lisa?
Aye.
Laura?
Aye.
Kristen?
Aye.
Julianne?
Aye.
I also vote aye. Vote is unanimous. Public hearing is now closed. Are there any other comments or questions from members of either board at this time? Okay. I have one financial question that I'm just curious because it wasn't spelled out in the report. For the existing department budgets, are those the FY24 current costs, or are those the projected FY25? You're muted, Connor. I couldn't read your lips.
FY24.
Those are FY24 and the projected is FY25, right?
Correct.
So we've got a 1% increase fiscal year to fiscal year, which to me sounds like actually a slight decrease because the existing budgets would increase by, 3.5%, I imagine, year to year. Tim, am I doing my math right?
I mean, everybody else is growing at that rate. Because it's synergy for merging the two departments. That's where the savings is. Or the non-exponential growth.
Yeah. So FY25 to FY25, we're looking at actually a decrease of 2 to 2.5% to do this of those department budgets. Thanks. Any other questions or comments? Again, from anyone on the call? Members of the Board of Health, it does not look like you have a current quorum, so I'm not going to ask for a formal vote from you to recommend something either way. But before I ask for a vote from the Select Board individually, do you have any recommendations for us from either Lisa Bennett Johnson or Dilip?
I would just say I realize it's a long document, but it's our responsibility to the community to understand this document. Took me some time to go through it. I would encourage you to get a cup of your favorite caffeinated beverage and spend a good hour and go through it to know it intimately. And I think it'll help those in the community that may, need to understand it a little bit better. We've had some good conversation here. So I hope that you do approve this to go forward. I think it's in our community's best interest, and we have nothing to lose.
Thank you, Lisa.
Thank you.
Dilip, do you have anything else that you wanted to offer in your role on the Board of Health? Okay, I'll take that as a no, but feel free to chime in if needed. Members of the board, are we ready for a vote? So procedurally, because this is a structural change, it looked to me as per the charter, Tim, correct me if I'm wrong, that at least 30 days in advance of town meeting, the select board needs to recommend that type of change. And that is the motion that is recommended for us tonight. That would then place it, as we have already done in terms of the warrant, it would carry it forward for a vote at town meeting. If town meeting then approved it and we approved it tonight, then that would be the new structure soon after town meeting as of the beginning of the fiscal year. Tim, do I have that right?
Yeah, it's more the charter calls out for the hearing process to take place 30 days prior to. I'm not sure about the recommendation. I know that it can't go forward if the board does not recommend it, however.
Right.
Look for an affirmative. It just doesn't want a negative.
Okay. Well, it sounds like we're ready to make a decision, so I will entertain a motion on the proposed amendment to the town's municipal code.
Mr. Chair, I move the board vote to support the proposed amendment to the town's municipal code for the creation of a Health and Human Services Department and the reorganization of the Health and Inspection Services into the Human Services Division pursuant to Article 5 of the Town Charter as recommended by the Northborough Health and Human Services Strategic Assessment Report prepared by the Central Massachusetts Regional Planning Commission, and to support an article for the same purpose on the annual town meeting warrant.
Second.
Motion made by Kristen, seconded by Julianne. Any other discussion? Hearing none. How do you vote, Kristen?
Aye.
Julianne?
I have a procedural quandary. I wanted to go to town meeting because I think it's up to the taxpayers to vote on this. But as it is now, I still have some concerns. So I think it's best for me to abstain.
Okay. We will still need 3 of us to vote to move it forward. If you're interested, Julianne, is in moving it forward to town meeting, I would suggest voting yes, and so that town meeting has the opportunity to do that. That's up to you. Do you want me to come back to you?
Can I pass and let the vote?
Of course.
Can I ask to be at the end of the list?
Of course. Laura, how do you vote?
So I'm so grateful for everyone's feedback today and all the discussions that we've had. I want this to go to town meeting so that people have the opportunity to make their votes be heard. I feel like we've really got some great feedback on both sides. So I will vote for it. Or yes, aye.
It's a vote in favor? Okay, thank you. Lisa, how do you vote?
I too am having difficulty. I would have liked to have had more public input tonight, more public input in other times, but it is up to the town to make that decision, I suppose, and I hope they get enough information in advance. I can really appreciate everything that this team has put together and all the time that they put in, and I mean, there's just no amount of appreciation that you could say. I mean, you've really done a very hard job. It's a change in the charter. I almost wish we could do a year of a pilot program and then make it into the charter change. But I feel the same way that Julianne does, and that it's, I don't know that, I don't even know that I have enough information to make a good choice either way. So with that being said, it will be up to the people, and I will vote yes, being up to the people, but that I don't know that I personally have enough information to do it correctly.
Thank you, Lisa. Julianne, back to you. Do you want to hold on to your abstention, or do you want to change it?
Well, if I hold on to my abstention, it will still go to town meeting, which is my desire, correct?
That is correct. It would be 4 in favor, 1 abstention. Well, I will be voting yes. So,
okay.
So
we're good.
4 in favor, 1 abstention. Yeah. That's essentially, it's unanimous approval with 1 abstention. All right. So I vote yes. It is unanimous with 1 abstention. It will go forward to town meeting. Thank you very much, Connor and Isabella and everyone else who put this together. Thank you to the members of the Board of Health that were able to join us tonight. And that concludes our business for the night. Unless anybody has anything else, I will entertain a motion to adjourn.
So moved.
Second.
I heard a lot of so moved. Let's say Kristen and Julianne second. Does that work? Yep. All right. All those in favor of adjourning: Kristen?
Aye.
Aye.
Julianne?
Aye.
Laura?
Aye.
Lisa?
Aye.
I also vote aye. Vote is unanimous in favor. We are adjourned 9:56 p.m. Thank you very, very much, everybody.
Thank you.
Have a wonderful night.
Thank
Good
you.
night, everyone. Thank you.
Thank you.
Thanks,
Thank
Connor.
you.